Welcome back to Morning Break, and today's Brain Matters segment brought to you by Dr. Randall Gates, who is a board-certified chiropractic neurologist and chiropractic physician at Gates Brain Health. And today we're going to talk about an important part of the brain, the parietal. You're not even going to help me. He's like, nope, I'm just going to let you say it. Parietal, insular, vestibular, cortex. You know, we've done so many of these interviews. I thought for sure I was going to nail the term parietal, insular, vestibular, cortex. So
yes.
Not only can I not pronounce it, but I have no idea what this part of the brain is. Can you tell us about it?
So the insula is a really interesting area of the brain because it's oftentimes forgotten because it's actually a lobe of the brain inside other lobes.
Okay.
If that makes sense.
Yeah.
So we know, like the frontal lobe, you probably have heard of that. The occipital lobe, where vision basically is computed. We have the temporal lobe for hearing and memory, and then we have the insula, which is deep down underneath the temporal lobe, the parietal lobe, and the frontal lobe.
Yeah, and I think we have a picture of that so you guys can kind of follow along with us to see what we're talking about there.
There we go.
So it doesn't, it's hard to tell, but what you're saying is that that red spot there, that is underneath other lobes.
Correct.
Okay.
Correct, yeah. So there's kind of a infolding and it's in there, and that's really, the insula is in there, but that's really the parietal insular vestibular cortex.
And so even though it looks really small in comparison to everything else, it's very important.
It's very important because a lot of our internal bodily sensations are formed in the insula. As an example, there's a really high preponderance of panic attacks after vertigo disorders.
Interesting.
Like sometimes it's around 30%. It's incredibly high. And researchers think because when we lose the inner ear's function, then the insula becomes imbalanced and we have no way of deciphering what is normal, what's abnormal for our internal bodily sensations. So that can then create the panic attacks.
Interesting, because like what I know a little bit about from, you know, my mental health with like panic attacks and things like that, the amygdala has a big role of that. It's it's close to that, isn't it?
Yeah, yeah, anatomically it's not far away.
Yeah, okay, so very interesting. So now when we talk about it with dizziness and vertigo, though, what role can that have?
In terms of the parietal insular vestibular cortex, it's so important because really that's our CPU for where we are relative to our surroundings.
Okay.
And I think we become so singularly focused in our current healthcare model. When we're dizzy, we think, okay, get your heart checked, absolutely. Make sure you don't have an electrolyte disorder. But we become very focused on the inner ear most of the time. And the inner ear certainly is important, but really a lot of patients come away with dizziness with a diagnosis of like triple PD, where they're dizzy when they're up moving around, they don't feel well, they feel better when they're sitting down. And a lot of that really stems from this parietal insular vestibular cortex.
So if that's what's going on kind of inside the brain that may be contributing to somebody's dizziness, what are some of those factors outside of the body and outside of the brain?
Body, yeah, those would be the heart, certainly electrolyte disorders, things like POTS, postural orthostatic tachycardia syndrome. We've talked about that a lot on this show. Those are common causes of dizziness.
Okay, so
outside of the
the part that we're talking about today, is there a reason why it's so forgotten?
Well, I think there's a reason it's so forgotten because we're so singularly focused. So people are dizzy and they get their inner ear checked. They go to the audiologist, they go to the ENT. I'm not dissuading anyone from doing that. Absolutely do that. But then a lot of people are just left dizzy. They may go through physical therapy. It may work, it may not. But if it doesn't work, then they don't know why. And looking into these deeper structures of the brain, there's a ton of literature on this that can really help someone to get answers as to why they're still dizzy. And it can help them to create a rehabilitative strategy, or the doctor, for them.
Yeah, and I think one of the things that's important about the way you're taking it with Gates Brain Health is that you are working alongside of all of the other things that could possibly be on top of the brain.
Correct.
And so you're taking a look at, you know, different areas so that you can rule those out and maybe get to the bottom line a little bit faster or a little bit easier to really make sure that these people who are experiencing dizziness without answers so far are getting those answers.
Absolutely. Yeah, and lots of times patients, they come to us and we find other things that need to be looked at, like a cardiology referral. But yeah, we are trying to look at all of those factors for someone who's suffering.
Yeah, and then for that part of the brain, is it a CT scan? Is it the MRIs that you guys do at Advanced Imaging Reno? How do you guys actually study that part of our brain?
A lot of it is through vestibular testing, neurological testing. Yes, imaging is really important to make sure there's not something growing in that region. I have seen that before, where unfortunately somebody had a mass in that region of the brain and that was creating dizziness.
Okay, so
yeah.
there's lots of options for you. If you are experiencing dizziness or vertigo and you just feel like you're not getting an answer to the root of the problem, Gates Brain Health is certainly here for you. Is there anything else that you wanted to add?
No, and they can check out our YouTube channel. And
Yeah.
we really aim to help people quickly.
Yes.
That is our aim.
Absolutely.
Yeah. And we've talked about the VNG examinations and other.
Yes, the one that's the goggles, right?
That's the goggles. So we do those on patients twice a week. So it's really comprehensive
Yeah,
what we do.
absolutely. Well, I'll make sure that all of Gates Brain Health's information is on our website, colatv.com, after the show, so you guys can go ahead and check it out. Dr. Gates, thank you so much for being
Thank you,
here.
Katie.
We appreciate it. Thank
Yeah.
you. And thank you guys for watching. We'll be right back.